Now, moving on to bispecific T-cell engagers. This is also a form of cellular immunotherapy where we actually do not genetically modify white blood cells of a patient, but utilize the already existing immune system and its white blood cells and harness their ability to kill myeloma cancer cells. Here you see the structure of a commercially available bispecific agent known as Teclistamab. Teclistamab is a bispecific T-cell engager. This is a drug that has two arms, and with one arm, this drug actually binds the T cell. With other arm, it binds the myeloma cancer cells. It brings them together, activates the T cell, and allows it to actually kill the myeloma cancer cell. Contrary to the CAR T cell therapy, this is a continuous therapy where the treatment has to be given every week to the patient and has found to be very effective in clinical trials that I'll be discussing in next few slides. So Majestic 1 was actually a clinical trial that evaluated the role of this bispecific T-cell engager for patients with relapsed refractory myeloma. This patient population on the trial was very similar to what we studied on with the CAR-T trials, where 165 patients on average had received 5 prior lines of therapy. Nearly 80% of the patients were triple-class refractory. 25% of the patients had high-risk mutations. When they received the Teclistamab therapy, nearly 65% of the patients, which is 2/3 of the patient population, actually had a response. A vast majority of these responses were actually fairly deep responses. And on average, these responses actually lasted for about 18 months. Common side effects included CRS, again, in the form of fevers, which was seen in about 70% of the patients. And very few patients actually experienced any confusion after receiving this treatment. A common and more challenging side effect was actually low immunoglobulin levels, which put these patients at a high risk of infections, which are actually seen in nearly 3/4 of these patients. This therapy has been commercially approved and available for patients with relapsed refractory myeloma who have had at least 4 prior treatments, including exposure to drugs like CD38 antibodies, immunomodulatory agents, and proteasome inhibitors. Other bispecifics that are currently in development in trials and have been studied for patients with relapsed refractory myeloma include a drug by the name Talquetamab. This particular bispecific agent targets another protein on the surface of myeloma cell known as GPRC5D. It sounds like a number plate, a long convoluted name, but essentially represents a protein on the surface of myeloma cells that this particular therapy can target. On a trial, it showed very remarkable efficacy, with nearly 70% of the patients responding to the treatment with Talquetamab. Common side effects that were seen that the patient experienced in this trial included skin and nail changes and loss or change of their taste. Another bispecific agent that is currently under evaluation in clinical trials is known as Teclistamab. It's a bispecific chemotherapy that targets the protein FcRH5 present on the surface of myeloma cells. The trials that have been ongoing, it has found to lead to a response in about 50% of the patients, and again, will be a promising option for patients with relapsed refractory myeloma. Alentamab is another bispecific, and just like Teclistamab, it targets the BCMA protein on the surface of myeloma cell. It is currently being studied in several trials and has shown fairly remarkable efficacy. It's also going to be given as an injection and can actually be given every 2 weeks rather than on weekly basis.